Hey, Grandma. You know what we're going to be talking about today?
No.
Type 2 diabetes. That's what you have.
Oh, I do?
Yeah.
So are there like signs and symptoms to find out when someone has type 2 diabetes like grandma here?
Yeah, actually there are. First of all, let me explain what type 2 diabetes is. Basically, let's say this is your cell and this is glucose right here. Typically, in somebody's body, insulin is the key that allows glucose to enter the cell and be used as energy. In someone with type 2 diabetes, insulin is not there. So the glucose cannot enter the cell. Now, to answer your question, Jaden, some signs and symptoms of type 2 diabetes include being very thirsty and urinating a lot because your blood is so sugary. There's so much glucose in your blood that your body has to push it out. You could be very hungry because your body isn't getting the nutrients it needs. So it's telling you you need to eat more. Another thing is you can be losing a lot of weight because your body's starting to use fat because it's not getting energy from you eating. You can feel very tired because your cells, they're not getting the energy that they need. Other things that can occur is like eye issues because blood isn't flowing. Since your blood is so much thicker because of all the glucose in it, it's not flowing to your eyes properly, which can cause blurred vision. Numbness or tingling in the fingers or toes because again, blood flow isn't getting to those areas, so it can cause that tingly feeling. Wounds can take longer to heal because your cells, they're not getting the energy to divide, so they can't replicate and they can't produce new skin cells. In males, erectile dysfunction can occur. And then in females, vaginal infections can occur just because the blood sugar is the sugar in our blood, the bacteria in that general area, they feed off it. So those are some signs and symptoms that can occur.
This sounds really serious. Are there any risk factors to having type 2 diabetes?
Yeah, so some things that make you more susceptible to getting type 2 diabetes include obesity. If you're obese, you're more likely to have fatty deposits, which can block your insulin receptors, not allowing insulin to work properly. If you're over the age of 40, your body tends to produce less insulin, so that could also put you at risk. Your genetics, how much your body naturally produces insulin, and then your lifestyle. If you eat a lot of fatty foods, even if you're not obese, those can still cause fatty blockages.
Man, this seems pretty serious. Is there any like long-term problems we could have here with grandma?
Yeah, so if grandma's type 2 diabetes gets out of control, she could potentially lose her eyesight. If the eyes don't get blood flow for long enough, she could lose her eyes. Another thing is heart disease. Heart disease is, since your heart is working so hard, it can cause a heart attack. Kidney disease is also another thing that can occur. Your body's filtering out that glucose a lot, very frequently, and over time that can cause kidney erosion. Neuropathy, like I said before, the tingly feelings, if that goes on for long enough, you can lose full sensation in your fingers and eventually even lose a finger itself. And then lastly, hypertension, high blood pressure. That's just not good at all.
I'm really worried about grandma now.
Yeah,
is there any way to like treat this and like help her get better and to not have type 2 diabetes?
Well, there's no cure for type 2 diabetes, but there are treatments. First, we can put grandma on oral meds. That basically would help her pancreas produce insulin. Another thing is if we find out that grandma's pancreas is actually producing a little bit of insulin, we can control her carbs so she doesn't overeat carbs and her blood sugar levels stay relatively level.
No more pasta.
No more
No.
pasta, Grandma.
Sorry, Grandma. I know it's your favorite.
Another thing is, I don't think Grandma has this issue, but if she were to be overweight or obese, or maybe she didn't have the best diet and ate a lot of fats, we could change her diet up and she could exercise more. Exercise promotes fat loss, so maybe get rid of those fatty deposits blocking the insulin. And then lastly, we could just monitor Grandma's blood sugar levels and make sure they don't get out of whack. That's probably the most proactive and productive way of making sure those lesser symptoms don't become those more major complications.
Okay.
All right.
I appreciate it. Thank you.
You're welcome. Grandma, do you feel more informed about type 2 diabetes?
Oh, I feel so informed. Thank you, honey.
You're welcome. You're welcome.